Good afternoon, everyone. I'm Sally Cummins, Vice President of Sustainable Nutrition Affairs at National Dairy Council, and I'd love to thank you for joining us during Hunger Action Month for the Ethics of Hunger, Nourishing Communities in Need. Before we get started, I just wanted to share a few quick reminders. For the best experience today, our preferred browsers are Google Chrome and Firefox. If you have any technical difficulties or questions, just type that into the window on the left-hand side. And if you're posting on social media, please use the hashtag Dairy Nurses Life and Hunger Action Month. After the webinar, you should receive an email with your continuing education certificates and copies of today's slides within 24 hours, and the webinar will also be posted on usdairy.com next week. We do get quite a few questions about handouts and continuing education certificates, so I just wanted to take a quick moment to show you where you can find the downloadable copies of today's slides, as well as Clancy's excellent resources. So as you see here, on the left-hand side, they're down under downloadable files in the email that you received yesterday. And within 24 hours, you will receive a second email that has your continuing education credits. You can see that they are located under the downloadable files as well. To kick off our webinar, I just wanted to point out an excellent documentary that was in New York Times Magazine earlier this month, where a photographer took a field trip from New York to California to document those who were struggling with food insecurity. It really is an eye-opening documentary on how the COVID-19 pandemic has truly put food insecurity in the spotlight. With skyrocketing rates of unemployment, tens of millions of our neighbors are relying on food assistance programs as they're forced to make decisions about how to spend their limited budgets. In fact, Feeding America has estimated that more than 54 million people, including 1 in 4 children, may experience food insecurity in 2020. As health and wellness professionals, we all have a role to play, from raising awareness of the impacts of food insecurity to screening food insecurity and connecting people at risk, some of whom might really surprise you with resources and support. To help us meet this challenge, I'm honored to be joined today by our keynote speaker. Clancy Harrison is a registered dietitian, TEDx speaker, and author, and Clancy challenges the way food insecurity is approached in the U.S. Her mission to demolish the stigma around healthy food access places her on the cutting edge of advocacy. Clancy is the founder of the Food Dignity Project, a strategic program for leaders who want to shift how they approach nutrition outreach by making healthy food access a priority. She transforms the lives of thousands of people through her work with corporations, nonprofit organizations, and universities. Currently, Clancy is an advisory board member for the Pennsylvania American Academy of Pediatrics Food Insecurity EPIC program, an ambassador for National Dairy Council, and the president of Al Beach Westside Food Pantry. Since the onset of COVID-19, Clancy has distributed over 1 million meals in her community to improve access to healthy food. And you can tune in weekly to hear Clancy on the Food Dignity podcast. But before Clancy helps us wrap our heads around the ethics of hunger, Jerod Matthews with Feeding America, the nation's largest domestic hunger relief organization, will help us understand the impact of COVID-19 on hunger in America and illustrate Feeding America's efforts to provide food insecure families with better access to a wide variety of foods, including fruits, vegetables, whole grains, protein, and dairy. And Jean Ragalie-Carr, President of National Dairy Council, will kick us off by sharing National Dairy Council's historic commitment to hunger in America. And we'll also hear from Jean after Clancy when she'll share how National Dairy Council and your regional dairy councils can help fight food insecurity in your area. And with that, I'd like to turn it over to Jean.
Well, thanks, Sally. We know many of you continue to work on the front lines as healthcare practitioners or school nutrition professionals, food bank leaders, and volunteers or farmers and more. And we all owe you a great gratitude and want to just say thank you for that hard work that you do as essential workers. For those of you not familiar with National Dairy Council, we're a nonprofit organization founded in 1915 by dairy farm families because they believed in science and the importance of understanding how dairy foods may benefit human nutrition and health. And today, National Dairy Council represents over 37,000 dairy farm families across the U.S., as well as dairy importers. On behalf of America's dairy farmers, our diverse team of scientists, registered dietitian, nutritionists, and communications professionals strive to bring to life the dairy community's shared vision of a healthy, happy, sustainable world with science as our foundation. The U.S. dairy community believes in a world well-nourished and are committed to providing responsibly produced, nutritious dairy foods that help nourish people, strengthen communities, and foster a sustainable future. We're really proud to be representing our dairy farm families that have championed the well-being of children for over 100 years. You know, our history includes funding the groundbreaking research of Dr. E.V. McCullum, which revealed the importance of milk and other dairy foods in 1917, and then launching a nutrition education program in 1929, which helped form the USDA's National School Lunch Program. Participating in the 1940 White House Conference on Child, Youth, and Development, and developing the 1941 Guide to Good Eating, which predated any other food grouping system. And also creating Big Ideas, the 1971 Comprehensive Nutrition Education Program for grade school students. Then fast forward to the year 2010, and we created an in-school nutrition and physical activity program called Fuel Up to Play 60. So as I reflect on the history of the organization, it has been grounded in four things, or really three things: nutrition research, education, and partnerships since the very beginning. In addition to child nutrition, National Dairy Council has been committed to nourishing communities in need through partnerships with other organizations who share the same philosophy. In 2012, National Dairy Council, the Academy of Nutrition and Dietetics, and Feeding America partnered to raise awareness of the hidden face of hunger and food insecurity as a public health issue. From the start, this initiative has engaged agriculture, nutrition, health, and the hunger relief professionals in a dynamic collaboration to increase awareness on these topics, promoting access to healthy foods, and provide quality education resources for Academy members. And now, nourishing families during the COVID-19 pandemic has been so important, really more important than ever. Through our partnership with Feeding America, dairy farm families directed work nationally and locally, and has led to over 465 million pounds of dairy being distributed through the Feeding America network of food banks within the last year and during this pandemic. We are working to redirect milk and dairy foods from other sources across the value chain into food banks. I'll share some case studies later in the webinar, and with that, I'd like to pass it over to Jerod Matthews, Director of Dairy Supply Chain Partnerships for Feeding America. Jerod?
Thank you, Jean, and hello to everyone joining the call today. I think I'll start with just sharing a little bit about who we are as an organization and our basic infrastructure, just to provide some context for our discussion today. Feeding America, as we better call it, FANO, is the Feeding America National Office, but Feeding America is a network of 200 food banks with 60,000 agencies that consist of feeding programs, for example, like the food pantries, the mobile distribution programs you may have seen, school pantries, and a host of other distribution meal programs across the country. Typically operating in more normal times, we have about 2 million volunteers annually that support our food banks in a number of different capacities. Our food banks rely heavily on the support of our volunteers to execute and distribute the billions of pounds each year to the 40 million people we serve. Feeding America serves every community and every zip code in the U.S., including Puerto Rico, where there is food insecurity. I want to point out on this slide in particular that during our fiscal year 20, which ended June 30th, we distributed over 5 billion meals, which included a good part of the COVID-19 response to those in need. That 5 billion meals included 1.8 billion pounds of fruits and vegetables and over 465 million pounds of dairy. We source food from a number of different channels, mainly from our national and local food partnerships across the supply chain, including the retail channel, which is one of our largest streams. We also purchase food often to close the gaps that our food banks need to fill needed products that may not be available through donations. In addition to those two streams, we also source food through another significant large stream for us, which is the USDA government commodities programs, such as TFAP, that are known as the Emergency Food Assistance Program, and a number of other USDA commodity programs like Section 32 bonus programs, which have made significant impact to our network. During the pandemic, one of those programs which has made enormous impact during COVID-19 response has been the USDA's Farmers to Families program. USDA committed to the purchase of $3 billion of ag commodities of fresh produce, dairy, and protein products to be distributed across the country to nonprofit organizations to get distributed within those communities for those in need. The products were made available to anyone in need with very minimal requirements to receive the food from those distributions. In general, during pre-pandemic times, our food banks agencies have a very minimal requirements for our clients to receive food. We meet people where they are to help and provide support. Feeding people facing hunger is more than about simply providing food. It's about providing wellness, nourishment, and strength. That's why it's our mission to provide the most nutritious food possible to improve people's health and well-being. This has become apparent in a big part of our 2025 strategy, which is by 2025, Feeding America, in collaboration with our network and our partners, will ensure access to enough nutritious food for people struggling with hunger and make meaningful progress toward ending hunger. This year, we increased people's access to nutritious food by providing a record 5 billion meals to people facing hunger, including that 1.8 billion pounds of fresh fruits and vegetables and 4 billion pounds of good food that would have otherwise been thrown away. Additionally, 72% of the food we provided was considered foods to encourage. Our food banks have increasingly introduced nutrition criteria for the meals they serve to clients, and more than 2/3 of the foods distributed by the Feeding America network meet Feeding America's Foods to Encourage guidelines based on USDA's MyPlate guidelines, which also, as you all know, included servings of milk. Our food banks have stated that they are actively working on improving nutrition quality of meals provided to the food bank clients. Yet a good majority of those say they do not have enough milk to meet the demand. The number one reason cited is inadequate milk donations and refrigeration capacity. Milk is one of the most requested food items, but least donated to food bank clients. Sourcing and distributing food that is essential to a healthy diet helps us meet the needs of our people we serve. To do that, we constantly are innovating and building more ways to get perishable food to people who need it most, to equip them with new solutions. A few of those solutions that we at Feeding America have worked on over the last several years would be, one, starting with the variety of innovative dairy models that have been built over the past several years to provide fresh access for milk and other dairy products. Another is the Produce Matchmaker program, which connects growers with highly perishable fresh produce directly to food banks in our network. Meal Connect, which is a safe, quick food donations to make those donations possible by matching them for food businesses directly to our food bank agencies and food bank clients. One that you may be familiar with and have seen quite a bit over the last 7 months are our mobile food pantry programs. They provide a critical lifeline to healthy foods for families in hard-to-reach areas and underserved areas. Our mobile pantries create access to healthy foods by meeting people where they are. I want to reflect really on this mobile food pantries for a second, just to share a quick story that I had the opportunity to work with a gentleman that created this the mobile food bank concept. His name was John Arnold, who was the former executive director of the Feeding America West Michigan Food Bank. And I actually got a chance to accompany him on several food distributions of the program. You know, he came up with this idea of modifying a beverage truck, which we all have seen making deliveries in our communities to retail establishments and other businesses, and making it into a mobile produce truck to take into high-need communities, which today has evolved to expand to include many other products like our dairy products and other staples. Accompanying him on those distributions gave me a full exposure into seeing true impact and the true need in the communities we serve. I'll tell you, words cannot fully capture the experience of seeing and visiting with clients that are so grateful for the support they receive. So we're helping promote healthy food choices in food pantries, empowering the people we serve to make the best nutritional choices for themselves and their families. We're also researching how health and hunger intersect, which continues to be a high top priority at Feeding America. We know that there's a strong relationship between nutrition, health, and food insecurity. This is why we continue to conduct research on how these topics intersect and how we can use that knowledge to better serve people facing hunger. As Jean referenced a little earlier, you heard her mention about this year and the amount of dairy, the 465 million pounds of dairy that has moved through the Feeding America food banks. You might ask, okay, how have they done that? Well, we know that milk is one of the items most requested by food banks, but yet rarely donated. Feeding America clients receive the equivalent of less than 1 gallon of milk per person per year. We've been able to focus our efforts in a number of different business sectors to address those challenges. One being the government commodity program, starting with trade mitigation. That was the first time fresh milk had been distributed through a USDA commodity program, in addition to the other programs like Section 32 bonus, and now CFAP, which is known as the Coronavirus Assistance Programs, has made tremendous impact with our dairy access to our network and our initiative. Another area are purchasing partnerships that have evolved over the years that have been developed to bring dairy processors and our local food banks together in new partnerships and building those opportunities locally and nationally. Donations from our public and private sector as well, like the Great American Milk Drive, the Give a Gallon campaign, which are a national consumer donation program which brought national awareness to address the need for dairy access to the Feeding America network. And our other dairy donation partnerships that continue from retailers and processors that have really raised their partnership engagement to make milk and other dairy products more accessible to the Feeding America network. So let's get in a little bit about what we've all have been experiencing over the past 7 months now. The COVID-19 impact and response has led Feeding America to experience unprecedented times during a perfect storm, which consists of experiencing the pandemic, increased demand, a disruption in the food supply, less volunteers available to help us with these execution and distributions. All of that has been a really, really unprecedented times that we have experienced at Feeding America. We have experienced response to disasters, and we've done that traditionally over the years in more isolated events and areas. But our network has never seen anything quite like this before. We're having to really pivot not only internally at the national office, but also within our network as we figure out how to source and distribute resources to make the most impact for those in need. We are experiencing significant spikes in demand, disruptions in the food supply chain, who we normally work closely with to reach people with resources when they need it most. Taking an even closer look at the impact of COVID on household food insecurity, we know that the response, the COVID and the impact and the responses led Feeding America to experience those unprecedented times. During the 2020 coronavirus pandemic, it has threatened the lives and livelihoods of people throughout the world. Before the pandemic began, millions of people in the U.S. struggled with hunger. Food insecurity in the U.S. was at its lowest since before the Great Depression, and yet still 37 million people, including 11 million children, were food insecure. As of today, Feeding America estimates that as a result of the pandemic, that number may rise to 54 million people, including 18 to 20 million children, or 1 in 4 that would be impacted in 2020. The U.S. is facing an 8 billion meal shortfall in the charitable food system. We are analyzing how our network can meet and sustain increases in need as a result of the pandemic. Our network of food banks estimates seeing an average 60% increase in demand since the start of COVID. And we are working with partners like McKinsey & Company to address supply gaps and plan for the most serious scenarios if the virus is not fully contained this year. Feeding America estimates that the total need for charitable food over the next year will be an unprecedented 17 billion pounds, which is more than 3 times our food bank's network's last annual distribution of 5 billion pounds. We anticipate sourcing and distributing 7 billion pounds in food supply over the upcoming year, largely driven by the federal commodity food purchase programs I mentioned earlier. This will leave us with a 10 billion pound gap between now and June of 2021, which is equivalent to 8 billion meals. And yes, we definitely have our work cut out for us, but we cannot do it alone. Taking an even closer look at the impact of COVID-19 on household food insecurity, you'll see clearly that the Black and Latinx households have been disproportionately impacted during the pandemic. These communities of colors and others, like the Native American communities, have been impacted previously with special challenges, but those challenges now have been heightened because of the pandemic. This holds true and is also unfortunate as well in families with children in those same communities. You know, I want to take a minute to just reflect as we had this opportunity with this webinar that came up, and just last week, you know, something came to mind. I joined Feeding America for, some 14 plus years ago, and I was shocked with the number of children that were impacted by hunger and how they struggled with not knowing where their next meal would come from on a daily basis. I remember visiting a school feeding program in Rochester, New York, and sitting with one of the students while they enjoyed the meal that the school provided. The joy and the happiness they felt while eating and having a pleasant, genuine conversation with me carved a space in me, and is one of the reasons I continue to engage in this work. That day will always resonate with me. And until last week, it came to mind again. Those of you are familiar with Alexis Glick, the CEO of Gen Youth organization, was speaking at several presentations last week. And she made a statement just last week, and it took me back to my experience in Rochester. And I don't claim the statement that she made, but it really hit home. So I just wanted to amplify her statement, which was the only hunger children should face is the hunger to learn. So take a minute to think about that and the 18 to 20 million kids that will struggle to know where the next meal will come from over this next year. Just really impactful, and we have a lot of work to do, and there's no need that should not be happening. But another community that has been impacted hard because of the pandemic represents about 80% of our most food insecure counties in America, and that's the rural communities. The need is great in these areas as well, and it cuts across all types of demographics. Looking across all geographies, generally these trends will hold true as it relates to the impact of COVID-19. Places that had relatively higher rates of food insecurity before COVID-19 will continue to have relatively higher rates of food insecurity. Places that had relatively higher numbers of food insecure people, especially in higher populated areas before COVID-19, will continue to have relatively high number of food insecure people. But the third one, places that had relatively lower rates of food insecurity before COVID-19 will see the largest relative increases in food insecurity, even though their numbers would generally be lower in comparison. As of June 30th, Feeding America had distributed almost 2 billion meals since COVID-19 started, which we expect to be well over 2 billion meals today and moving forward. We've seen a 40% increase in those that are visiting food banks and agencies for the first time. And also, our network has seen a 60% increase in demand, and that's the average 60%. There have been higher food banks that have seen even higher demand in some areas, but on average, 60% increase in demand during the crisis. We expect the demand to peak this fall due to a variety of factors, including a possible virus resurgence this fall, rising food costs, which we are already starting to see, termination of unemployment benefits, and quite frankly, an economic shocks to household incomes. Our focus will be to continue to be on federal commodities, government relief packages, SNAP benefit expansion, and a retail recovery restart. In the early days of response, we as an organization had to pivot in a number of ways to address our food sourcing and distribution capabilities. We've had to address the disruptions in the supply chain, where we traditionally receive donations and support. Our network food banks had to adjust to the low, no-touch distribution programs with fewer volunteers, which makes it even more challenging. We've had to innovate and build new partnerships that have had to address logistical challenge in the transportation space. And we've also had to elevate and continue to build our focus on our efforts to make greater impact as it relates to the racial inequities in communities disproportionately impacted by the pandemic. But despite these challenges, we remain strong and resilient. The network is innovating and addressing this perfect storm every day to make sure Americans facing hunger have the food they need. Food bankers, volunteers, partner agencies are all on the front lines ensuring neighbors have the food they need during this difficult time. Our public and private partnerships are critical for overcoming the challenges COVID-19 has presented. Private industry, nonprofit, and faith-based organizations and volunteers are all needed together with significant government support and cooperation with federal, state, local government agencies will be critical in our work moving forward. This has always been Feeding America's approach. The COVID-19 pandemic has caused a public health and economic crisis, the effects of which are widespread. Federal nutrition programs, especially the Supplemental Nutrition Assistance Program, better known as SNAP, will continue to be important for addressing food insecurity for millions of people, especially during this time of high need. For every meal served by Feeding America, SNAP can provide 9. Promising steps are being taken right now to increase these benefits and will need to be continued to help individuals weather the storm we're experiencing today. In addition to SNAP and other opportunities to source more food, we as an organization must continue to focus to build our network's capacity to receive and distribute more perishable products to close the demand gap for those in need. The COVID-19 crisis has dealt us a big blow to the economic health of individuals and communities across the country, and the effects have the potential to be long-term. For now, with no immediate end to the pandemic in sight, demand for charitable food assistance is expected to remain at elevated levels for the foreseeable future. Unfortunately, this picture you see is probably not changing for quite some time. It will be important we all continue to find ways to work together to help address the needs of individuals and families in our communities. At this point, I'll transition over to Clancy, who will share from a local level more insights into what I like to call where the rubber meets the road in her community. Thank you for sharing your time today. Clancy, all yours.
Well, hello, everyone. Thank you so much for having me. It's certainly an honor, and we're going to dive into the ethics of hunger. But before I jump in, I kind of want to give you a little idea of where I came from and how I got to a big piece of this plays a role in how we can all approach food insecurity. So I am a recovering food elitist, and what do I mean by that? Well, I'm a recovering food snob, and according to, I'm sure, many other people, I am probably still a food snob. And there's nothing wrong with that, but what I did as a dietitian is I created fear and shame and guilt around certain foods while I put other foods on a pedestal. So just for example, in 2014, my book came out, and it really was written, even though there was a lot of evidence-based material in there, and I'm very proud of it, I did come from a mindset of my food philosophy, what I felt was important for me to do with my family as a upper middle class white female, to be frank. And so if there were foods, maybe if they had red food coloring, I would call them poisonous or toxic. And looking back on that, I probably shouldn't have gone there. And the other thing, the reason I have two pictures of me on this slide is because those kitchens weren't even mine. I was taking headshots in other people's kitchens, trying to project an image, and so I really wasn't being authentic to myself. And then around 2010, 2011, I became the president of the Owl Beach Westside Food Pantry in Kingston, Pennsylvania, which is a very large food pantry. And during that time, I had some internal dialogue on whether I was going to want to be the pantry president, because it was volunteer, and I'm a rule follower. And while this might upset or trigger someone, what I'm about to say is my truth, and it was a misconception that I had at that time in my life. But I really thought when I would come into the food pantry that there might be people who would take advantage or show up and get the free food when maybe they didn't need it, when maybe they should have been working and not using their tax dollars. And again, that was an internal conversation. I wasn't having this with the general public, but thank goodness the good voice started speaking. And that good voice said, you know what, it's not your place to judge, jump in, you like to help people, you're a dietitian, you were a food service director in the school system, and how to distribute food, and just go do it without any judgment. And above all, have fun in the process. And that's what I did. And while I was there, I had a lot of aha moments, but one thing in particular happened was that I was recruited to be the leader in the Community Voices Project, and hopefully we'll be able to bring this project back. It was with Feeding America, our Academy of Nutrition and Dietetics, and other major programs that were advocates for anti-hunger. So the purpose of this was to bring the real face of hunger to Congress, not just statistics. And for the first, sit down and listen, right? What a concept. Just listen to someone's story, whether that story is how they found themselves at our food pantry, maybe it's a story of how they experienced hunger as a child, and then what does that success look like? What happened when they were able to utilize WIC and SNAP and school meals? And so again, I had a lot of moments of clarity, a lot of moments of where did my thought process come from, and I had to jump into the and what I learned was that I made a lot of assumptions because I pretty much operated in my own social bubble, which I think many of us do. We tend to hang out with people who are like us and not put ourselves in situations that might be unfamiliar. And so when I looked at the research and from my interviews, and even now as a keynote speaker that travels around the country and talking to people, the reality is
Clancy, this is Sally. I'm sorry to interrupt you for just a moment, but we're having some connection issues with your audio, so if you can just maybe speak closer to the phone, and I'm not sure if you're walking as you're talking.
Okay. Now I have a headset on. Is that better? Can you hear me?
That seems a little bit better. Yes.
Okay. Maybe if I hold my phone up too, but I have a headset.
Okay. Thank you.
So, okay. Sorry about that. So most people who are coming in are, again, they're looking for work, and we see this a lot with COVID now. We have a lot of people who have been laid off. We have single mothers, women running from domestic violence. We have an elderly population who has slipped through the cracks. We are seeing a lot of research now with college students. And I have to tell you, we have veterans driving through. I would say 1 in 4 cars is a veteran wearing their hat. That's how we know, or they have the sticker on their car. And one example, you know, I talk about perceptions and judgment and misconceptions, and I have to check that every day. And just a couple of weeks ago, maybe a month ago, when people are, this is my latest story of judgment, but when we have people come through the line in their cars, they usually give a dollar bill, maybe a $5 bill. They want to contribute to our food pantry in some way, so they're not just receiving. And a big piece of that, I think, is their dignity, right? So at the end, we usually don't run out of food, but we might run out of milk. Again, that's one of our most requested items. And so we start to give that money back to people. And we say, you know what, we ran out of the milk, but here's $10. Go get milk and anything else that you need. And I came down to my last, it was $5 and $3 bills. And they were old, wrinkled up. And I thought, I can't just give $8 to someone. What is $8 really going to do? This might be embarrassing for them. But again, that good voice that brought me into the food pantry a long time ago, talked and said, just give the lady the money and just walk away. Just smile and say, here, I hope this will help you. And she started to cry. She said, we used the last of our gas to get the food, to come here to get the food today. And my son is the only person who still has a job, and we did not know how he was going to get to work tomorrow. So they were making a difficult decision between, do I use the last of our gas to get food or to go to work tomorrow? And so that $8 meant so much to her where it might not have meant a lot to me. So then again, that's just a situation where I was projecting my perceptions out into the world. So this slide is really my theory based off of my speaking, based off of speaking to people, and also listening to stories, and also the research. So I saw, and I see that my assumption played a role in the hunger crisis. So when I thought maybe I was the solution as a dietitian, you know, even as a food service director or someone working with patients coming in for diabetes management, I was actually part of the problem. Because if we assume we know a person's ability to their food access and we're not asking the right questions, we can potentially encourage the stigma associated with food assistance programs. We could potentially, we could make chronic diseases worse. We could perpetuate the cycle of poor food access, and we could potentially increase the risk of 10 major chronic diseases, which are listed there, and we have more of that on another slide. So that's why I wanted to be more of the solution. And a big piece of that is fighting hunger from an ethics standpoint. Many times we think of hunger as maybe a third world problem, maybe an inner city problem, but also a moral issue, or maybe even just charity, right? I'm actually standing in our church today, we're doing distribution, and we look at this as a charity, but I'm challenge you to take it a step further and think of hunger as an ethics issue. And that's why I started the Food Dignity Project. It's a nonprofit where we're really challenging the stigma associated with food assistance programs so we can change that culture. And if you look at our code of ethics for the nutrition and dietetics professionals, we want to make evidence-based practice decisions, taking into account the unique values and circumstances of the patient, client, and the community in combination with the practitioner's expertise and their judgment. So some of the things that I did as a dietitian when I was working as a diabetes educator, I assumed that people could have access to their car or public transportation. But really, if we look at the inequalities of transportation, people who live in food insecurity households are more likely to rely on someone else or maybe alternative forms of transportation. I can tell you we have people who show up in a taxi. We have a lot of walkers, we have bikers, and we have busers all coming to our food pantry. We even have a gentleman who comes through our line 3 or 4 times, and it's an elderly gentleman, and every time he has a single mom and a child in the back seat of the car, and he drops that mom off and he goes and picks up another mom, and it's the cutest thing, but he's helping people who might not have access to transportation. We also know that households are roughly 2.2 miles from the nearest SNAP authorized retailer or supermarket, a full-service grocery store, but they usually might have to travel on average 3.8 miles, and this could be because maybe they're doing multiple trips, maybe their bus route takes them to a farther grocery store, or maybe they're working on someone else's schedule, hopping in their neighbor's car and going to that person's grocery store, the one that they like to go to. So if we look at these inequalities a little bit deeper, the travel time could be a lot longer for someone who has to take 2 bus routes. They might have limited number of bags on public transportation. And actually, I pulled this picture from social media, and believe it or not, it was someone actually shaming the gentleman sitting there because he was taking up seats with his groceries. Now, hopefully this guy never saw that, but I'm sure other people might have seen it that have done the same thing when that's their only way to get their groceries. So clearly more planning is required, especially if there's various routes and stops. I also assume that people had access to a traditional grocery store. But if we look at, by 2021, dollar stores, the chain of dollar stores are expected to grow to 38,000 stores. And I can tell you many times I've been speaking, especially at the college level, and their students, they will raise their hand and they will say, my closest grocery store is a dollar store, and how can you teach me to eat healthy because I have diabetes or I have a heart condition? And so I do get that question a lot from my audience. I also assumed that anyone who, once they got to the grocery store, they would be able to go, and the grocery store will sell a large variety of fresh produce, wholesome dairy, lean meats, whole grains, everything that I would want them to eat. So not only am I expecting that they could drive, then they could have their pick of their store, and then when they got to that store, they would be able to have access to a great variety of food. But if we look at the food access inequalities with neighborhoods, people living in urban, rural, and low-income neighborhoods may have limited access to full-service grocery stores. So again, that dollar chain might be an option, maybe a convenience store, and small independent stores are common, especially in food deserts, more than full-service grocery stores. And then if you think about it, a convenience store, if you're going to go into a convenience store and buy a banana or an apple, you're certainly going to pay a lot more there than you are at a full-service grocery store. I also made the assumption that people could afford the food I recommended, so that they would get to the grocery store aisle, they can open up their wallet and pay for anything that I recommended for their disease management or disease prevention based off of proper planning and maybe even some budgeting. Here's just a line that a line of our food pantry, which actually mirrors what's happening outside of us right now, where I'm at. So let's just make sure we're all on the same page with the definitions of food security. So food security, there's really 4 definitions. On this slide, you're going to see 2, and those, according to the USDA, are considered people who are not food insecure, right? So high food security, we really have no reported indications of food access problems. When we get to marginal food insecurity, we're going to start to see some anxiety over if someone's going to run out of food. So for example, maybe someone is going to the grocery store, say mom's going to the grocery store, she has $50 and she says, I have $50 to feed 4 people. The 10 for 10 sales are going to start to look very advantageous. So they're going to be very appealing because I could buy 10 boxes of pasta, I can buy 10 cans of soup, 10 cans of veggies. And so we start to see that purchasing options take place. On this slide, we have the 2 definitions that are really food insecure according to the USDA. So those definitions are low food security. And again, the 10 for 10 sales are going to be very appealing, but what we're going to start seeing is reduced quality, reduced variety and desirability of the diet. So maybe at this point, mom might be diluting her milk so all the children can have milk with their cereal. And then once we start to get to low, very low food security, That's where we really see indications of disrupted eating patterns and reduced food intake. So we might be skipping a meal every day. We might go without food for 3 days. It just really depends on the house. And I think based off of my experience with speaking and talking to people, especially in the consulting, a lot of people believe that hunger is really the definition of that very low food security. But I want you to know that someone could be food insecure and eating pasta day in and day out, or instant noodles, or prepared pancake mix. They might be getting enough calories, but they're not getting the nutrients they need to live a healthy and active lifestyle. And they could be malnourished. So the prevalence of food insecurity, again, this is from 2018. Jerod showed you some numbers that are more recent, and you can just look at this again at your convenience, but it's a source from the USDA, and you could look at the farther out the bluer line, that's the higher prevalence. So you obviously can see that the income to poverty ratio is going to be a lead driver in food insecurity. But then again, just to echo what Jerod said, single moms with children. And then if you get into the race of the head of the household, you're going to see Black, non-Hispanic are more than twice as likely as white, non-Hispanic. So you can keep an eye on this, because I think it's really important that we start to really understand those numbers. If we look at the racial breakdown, 24% of Black Americans, 17% of Latinx, and 13% of Asian Americans do not own a car. And if we look at the food stores in the communities, they are often further away and have fewer high-quality options. And then 8% of Black Americans have a grocery store in their census tract. So imagine if you didn't have the transportation and you needed to get to a grocery store, but you can't even walk to a grocery store. It's going to present a lot of challenges. Here's just some pre-COVID data on food insecurity rates. The one thing that I want to point out on this slide is when you go to the Feeding America Network and you look on their website, you can see this box pop up. And in that box, that 32% is the number of people who are food insecure that do not qualify for food assistance programs because they make too much money. They live above that threshold to qualify. And these are numbers that we don't really talk about, but we should talk about. And again, this is pre-COVID. So imagine what's going to happen with all of the people with their hours being cut back, or maybe they lost their job. I am expecting this number to go up, but I encourage you to look at this number, keep an eye on it. You can look at this number, you can break it all the way down to your county level. And then again, here's just the projection breakdown from Feeding America. We don't really need to get into this. Jerod already talked about it. The only thing I'm really going to point out is that it's based on the unemployment rate, the increase. So there's 3 scenarios, and obviously the scenario C is going to have the most, and that's 17.1 million additional people. Oh, look, this is our food pantry, and you can see all the food on the stage. That's what we would go through in a month. And you see Kim sitting there, nice, calm. I didn't think it was calm back then, but it was very calm now that I look at it. It brings me a sense of peace. But you can see we have bags packed. We have about 35 families that come in and pick up their groceries, and then they could pick whatever produce they want and take it. This picture is now of our food pantry, and that is all of the space that is behind Kim, plus everything on the stage. Now, normally this space is completely empty, probably a bunch of empty chairs sitting around a piano for choir practice. So we've increased by 1,700%, which is a lot bigger than what Jerod was saying, but this is the caveat with us. People used to call had a waiting list, but now we have a truck-to-trunk operation, and we have the perfect driveway, so people can just come in one way and out the other. We put the food in the trunk, and we provide a lot of great food, and we've had some media support and a lot of community partners, so we just really expanded. And I have to tell you that what I have on here, a month's worth of food is gone within 3 hours. I was just working with dietetic students today, interns, and we recalculated that. And so it's pretty impressive the amount of food that we will go through. On this slide, again, Feeding America, you could Google the Feeding America impact of COVID on food insecurity, and you're going to get an interactive map. And I'm showing you Pennsylvania, specifically in Luzerne County, and you can click on it, and it will tell you the projected % increase in food insecurity, again, down to your county level. And I think it's really important that we start to pay attention to these numbers. So food insecurity could be long-term, but it could also be short-term. And I think we all understand the long-term piece. I really want to focus on the situational food insecurity. So again, it could be caused by the loss of a job, hours being cut back. Maybe the very reason someone is coming to you because of a diagnosis could be the very reason they need to have access to healthier food options. Maybe that's through WIC, maybe it's through SNAP, visiting food pantries, school meals. I can tell you someone in our family was diagnosed at the age of 44 with Parkinson's. He has 2 teenage girls, and he has a wife. He can't work now. He was told within 10 years he would be in a nursing home. We are 8 years into the diagnosis. So, you know, a medical expense could really set someone over the edge. And then we also have the affordable child care and housing, natural disasters, again, death of a family member, maybe even a birth of a family member, and again, the college student. So the face of hunger is constantly changing. Someone who's experienced food insecurity can look exactly like you. That could be the child playing against your child in soccer or sitting next to your child in school. I love that the journal of our academy in 2019, October 2019, they really focused on food insecurity. And right in the middle, they have an article, and I believe it's actually the name of this quote, is an interview with a bunch of college students. And a college student said, "It's a feeling that one is not worth food." And I just kind of want that to sink in for a minute. I can't imagine someone feeling that they're not worth food, because everyone deserves access to healthy food. And what I did was I created this graphic around additional research, but other things in that article, that when someone is experiencing food insecurity, they could be experiencing embarrassment, guilt, shame, anger, blame, worry, fear. That's what food insecurity feels like, and it's really hard for people to come out and ask for help when we might be projecting shame around that as well. So here's a cycle of food insecurity, and I like to put stress right in the middle, because it doesn't matter if you're marginal food secure, and remember that's someone considered who is not food insecure, there's still stress. And that stress is caused by poor nutrition intake, which leads to poor eating behaviors. There's also, according to research, a decreased opportunity for physical activity and poor sleep cycles, and all this increases the risk for obesity and the 10 chronic diseases, which is on the next slide. But what I want to show you here is the spending trade-offs. And I already told you a story of someone making a decision between gas and getting food at our food pantry. But there's other situations, especially in the winter. I'm in Pennsylvania. We're going to have people making choices between heat in the winter and feeding their family. Hygienic products. As soon as we have toothpaste, toothbrushes, you name it, diapers, all of those are very vital and important to our guests. So we make sure that we include those at our food pantry. Here's the slide that has, if we decrease access to healthy food, I think we can all agree we're going to increase our risk of disease. So there's a list of our 10 chronic diseases according to the USDA. So all of the hepatitis, stroke, cancer, coronary heart disease, asthma, diabetes, arthritis, hypertension, and high blood pressure, chronic kidney disease, and COPD. One of the things, once I started realizing that I had a lot of assumptions, I wanted to look at the research on how many people really participate in our federal food assistance programs. And this is old data. I really would love to have more research on this. But according to this article, 59% of households with food insecurity participate in at least one of 3 major programs. And I really feel we could do better than this, a lot better than this. And so I wanted to look at why are people not participating. And that was one of the things when I interview people we talk about, and maybe it could be that they don't qualify, right? We talked about people living above that threshold. Maybe there's stigma associated with asking for help, walking into a pantry. And I've seen that firsthand, especially when I started here, that stigma and the treatment by staff or even volunteers. Are we making people feel comfortable? You know, one of the things I had an intern who came in, this was a couple years ago, she was from Penn State, and I asked her what she was good at. What was her passion? And I told her it can't have anything to do with food. I didn't want to hear that. So she said, I'm classically trained on the piano. And I said, okay, I want you to pay attention to the mood today. And then tomorrow, I'm going to ask that you play the piano because we happen to have one in the fellowship hall. And she played the piano, and the mood changed. People, there was a spring in their step. They felt more comfortable. It was calming, and we had more dialogue. Other reasons why people might not participate, maybe it's the office hours that a WIC office is open versus when they're working. Someone who is experiencing food insecurity or living in poverty, one of the things, they're very resourceful, but they're also very reactive, survival mode, not really planning mode. So the thought process is, if I miss work to go apply for a program or maybe go and pick up food, I'm going to miss an hour of work. And that, however much that is it 10, is it $15, $20, could be a lot of money for someone. Maybe there's a lack of knowledge, so they don't even know if they qualify, how to qualify, what's needed to apply. And again, that is also lumped in with the technology difficulties. You know, can someone, do they have access to internet? COVID in our town really showed that many students did not have internet at their home. A lot of our public schools had to delay opening up at the onset of March to make sure that they had access to internet. And so that was, to me, that's a big sign that maybe people might have technical difficulties in applying for these programs. Again, we have transportation, and certainly racism definitely plays a role in someone's ability. And again, that goes back to how they're being treated by the staff. So what you do matters every single day. First, we need to recognize, educate, and then collaborate. So being here today, you're recognizing and you're also educating yourself. And one of the things with education is take that a step further. Start having conversations with your family about this. You know, a personal story on my end, I have someone who lived in my household who was my stepfather for, I don't know, it's been like 35, 36 years. And he told me that he was on food stamps when he was in medical school, but he told me this a couple years ago. And the point that I'm making there is if we're not having these conversations and we're having these secrets within our home, how are we really going to tackle the stigma associated with food assistance programs? So just start having conversations in your household. You don't have to go out and get a PhD and do research, but then how do you start having these conversations in your workplace around policy change and reaching out and having these conversations with the people that you work with every day so we can find out better the why behind people make food choices so we can better educate, and then certainly collaboration. So if we look deeper at the ethics of hunger, we want to act in a caring and respectful manner, mindful of individual differences, culture, and ethnic diversity. And we certainly want to promote the fairness with fair and equitable treatment. And here's some ideas of how we can do that. So the first thing, we really have to take a step back and say, are we asking the right questions? Because as healthcare professionals, we can certainly improve patient or client outcomes by satisfying the basic need of food access. And here, I love this. I have a new partnership with PAC Pediatrics. So it's a very large pediatric group. Those are the doctors, and they are screening for food insecurity. When they screen for food insecurity, we have it set up that they get a sample, right? Doctors love samples. So we give them a sample of the food, and that also includes diapers that people can receive at our food pantry every Wednesday. And then the family gets a VIP pass to come here. And we just started this, so we're really excited to see that we have 10 families coming in and utilizing our services. So So what questions? The questions we want to ask, you could look at the hunger vital signs. So these are validated 2-question tool. You can Google this and it will come up. But very simple, non-invasive questions. Within the past 12 months, we worried whether our food would run out before we got money to buy more. And the other one is within the past 12 months, the food we bought just didn't last and we didn't have money to get more. So if someone answers never true, that means they are food secure. But if they answer either often true or sometimes true, they are food insecure, meaning that we need to start having other conversations and dialogue with that patient. And we certainly want to code for food insecurity. Yes, I know that we're not going to get paid for it now, but unless we start coding, and especially coding with other codes, we could start seeing trends and we can start making a case to get paid. And certainly we want to screen for food insecurity in a very sensitive manner. So one of the ways we could do that, and one of the ways PAC does it, the pediatric group that I'm working with, they screen everyone on food insecurity at every single visit, whether they were there a month ago or 6 months ago, they're screening. And then they decide how they want to screen. Do they do it verbally or written? And we're starting to see some information come out, especially as we create these partnerships across the state of Pennsylvania, is that people like to see it in written form. They feel more comfortable asking. But if you are going to do it verbally, we want to consider asking when maybe the child is not in the room and maybe when you're alone with that person versus having an aide or a nurse or someone else or the doctor, just so it's one-on-one. And again, that's screening in private. And we want to normalize, and we can normalize saying, you know what, COVID has caused a lot of problems. We see a lot of food insecurity, and so we're just asking everyone this because we want to make sure that we're getting the food for your family and what you need to live a healthy and active lifestyle. And certainly if they speak another language, we want to use their language. Other ways you could do it in a sensitive manner is inform the person that most people do need help. And certainly we want to talk positively about nutrition assistance programs. I know that you do, but go the extra mile and say, you know what, this really helps people. They don't have to worry. Talk it up. Be clear that you're making a recommendation. You can use posters, and I know the Academy of Pediatrics partnered with FRAC, and they have a great toolkit that you can download for free, and they have posters and all kinds of ideas that will help you. And certainly if you can share a personal story, that's how I connect with everyone, as I share my personal stories. And that really starts to create trust and empathy. It helps people be seen. It helps people feel understood and more apt to share more information with you. And we definitely want to meet people at their starting point. Where are they? So we are the experts. As dietitians and healthcare professionals, we are the experts in food and nutrition, but we are not the experts in a personal hardship that our clients or patients face. And we're not going to know them unless we ask those right questions. And we need to really, to understand them, be able to understand the why behind their food choices. So I do have a checklist. We're going to go through this, but some of the things that you could start asking and talking to people about, first of all, you want to take an asset-based approach. Again, someone who's living in poverty is a very resourceful person, and that is a great way to start. We have people all the time sharing rides. You can borrow my car if I could use your stove. If you watch my kids, you could use my laundry. So very resourceful. You want to get specific with your questions, and you want to ask questions in different ways without pressure. And certainly, again, that connection through stories and situations, you want people to know that they're not alone. You're probably wondering why I have a picture of jelly here. I recently interviewed Amanda, a dietitian who was from Pennsylvania but now in Colorado, on the podcast. And what she did in Pennsylvania was she would do recipe testing using Feeding America foods, right, from our food pantry. And then she decided to take a step further. Instead of just doing the recipes, let's bring the clients in and we'll teach them how to cook, and then we'll also let them do a taste test. And the lady, they were making a barbecue sauce that had jelly. And the mom looked at Amanda and said, you know what, I would never use jelly in a barbecue sauce. Jelly is so important to me. Jelly is something I know my kids will eat. They will eat the peanut butter and jelly from the food pantry. I can't risk putting the jelly in a barbecue sauce because every drop counts. And if I miss that drop, then my kids might miss a meal. And for Amanda, listening to her share that story, that was one of her biggest aha moments as a nutrition educator, and really having that dialogue and creating that trust so we can find out some of these barriers that we face as nutrition educators. Some grocery store talking points and solutions. You could start asking, what is your favorite store to buy food at? What's the closest store from where you live? Some of those answers are going to really give you an idea of where they're shopping. And certainly, again, when you normalize, you can say, I know a lot of my clients rely on a dollar store for their food. Do you ever find yourself in a pinch or running into the dollar store for your convenience? That's a very easy way to start having that dialogue. And you can also say, you know what, I love the 10 for 10 sales. Do you find the sales helpful? And that can open up that dialogue, and you can go into what they buy. And then maybe you could start pairing, you know, those 10 for 10 sales with WIC items or some other healthier items to start making sure that it's a well-balanced meal. Transportation solutions. So I need to tell you this story first. A dietitian, I spoke on a stage, and then a couple, I don't know, a week or months later, I get an email, and she said, I was really aggravated with one of my patients. She said, I didn't understand why she wasn't using all of her SNAP dollars, but yet she was always eating instant noodles and potato chips. And she said, instead of me getting aggravated, I listened to you, and I went back and I had a better conversation, and I got to the why behind those food choices. And she said, the mom said, you know what, when I go to a grocery store, I have to take 2 buses. And when I get to the grocery store, there's a busy road. And I am a single mom, so I have to take my kids shopping with me, and I can't risk them running out into a busy road, so there's only so much I can carry. And then when I get on the bus, there's only so much I can have on the bus. And she said her number one reason for picking food, her food selection, was that it had to be light. And I don't mean light fat or anything like that. I mean light in how much it weighs, so she can manage her kids. And from that standpoint, the dietitian said, I have a better conversation rapport with her, and we can think of different ways to get food and solutions now that I know that. So I think when we start to understand the why, we're setting ourselves up to be better educators. If we look at kitchen equipment, some talking points, what's your favorite ways to cook food? And keep in mind, if someone says a microwave, that might be the only way they do cook food. And so you might want to start diving into other questions. We want to talk about, if I run into so many problems with my kitchen equipment at home, do you have any issues? Some people, believe it or not, at a food pantry, we ask for the flip-top cans because we believe that not everyone has access to the same working kitchen equipment that we do, and we want to make sure something as simple as a can be opened. So it's really important that you understand what's working and what's not working. And I do know that the Alabama Cooperative Extension does have a resource that's, I think it's Cooking Basics, and it has a list of things that you can substitute out if you're missing equipment with cooking. So some other things, long-term food solutions. We want to participate in these programs because people consume more milk, veggies, whole grains. They're using SNAP, school meal programs, WIC, and summer food service programs. And some solutions, can you provide a list of local, state, and national food assistance resources? And can you also provide a list of items that people need to apply for the programs? What are the eligibility requirements? I really feel the more that we can set people up with the tools, the more apt they will, the more chances they will to apply. So even if you could provide an application assistant technology help, you're going to get a lot further with that client. One of the things that Leslie Bonci, love her, dietitian out of Pittsburgh, she helped us create Eat Up recipes. So you will have access to that. So it's all of our food pantry foods made into recipes, especially since the onset of COVID. But benefits of food assistance programs, we want to, obviously they reduce food insecurity. They're going to give less stress, peace of mind. They stimulate the economy and the growth, and of course we see a behavior change in kids, whether that's academic, better sleep, better health. If we look at the 3 categories missing from the diet, they are veggies, dairy, and fruit. So what can we do? Well, first, I think we should acknowledge that milk, the nutrition profile is just, it's really tough to match. You know, milk is the leading food source of 3 out of 4 nutrients of public health concern. So we're talking about calcium, potassium, vitamin D. And of course, milk and milk products are recommended as part of a healthy eating pattern. And what I love best about milk is that it is equivalent to 9 essential nutrients, and that includes 8 grams of protein. And we know that if a child is getting their school lunch and their school breakfast, they're getting that milk that they need. And the other thing that the Feeding America Network also offers is dry milk powder. And I can tell you it's one of those things that people, sometimes they take it, sometimes they don't. Some people will tell us that they have had a bad experience as a child. So we can make milk powder fun, trendy, unique. It doesn't just have to be milk mixed with water, which I think is a great option. But what's great about milk powder, it has a long shelf life. It's easy for the recipes, it increases the nutrition in food, and it's free at most food pantries. So some of the things that you can do with that, you can add it to cooked cereals, mashed potatoes, meatloaf, hamburger, taco meat, breads. These are all great. You can say to your patient, you know what, we know that a child who's food insecure might have low bone density. So this is a great way to get additional calcium into that child's diet. Or maybe it's an elderly patient that you're working with. It doesn't really matter. We can start to boost the nutrition with dry milk. So we can add it to puddings, baked beans, canned soups. All of these are great options when we want to boost the nutrition. So plant plus dairy, it's definitely a win-win because it's affordable, tasty, nutrient-dense, there's low skill cooking levels, convenient and accessible. And what I love about all these pictures, all of that food is available at our food pantry. So one of the other things with the ethics of hunger is that we want to collaborate because we want to start to reduce the health disparities and protect human rights. So the best thing you can do, and if I were you, go ahead and screenshot this because you need to know the barriers. We cannot fully help someone unless we start to understand the barriers, and again, that why. We survey our participants, our guests at the food pantry all the time. So what could you do with either your clients or your patients? Start surveying them. You need to understand that individual barriers and there's community barriers. So again, shame, resources, maybe someone's childhood experience. You know, there's a picture of Pop-Tarts here because I had a client who was overweight. Her child was overweight. A young child also had diabetes, and she was always feeding her Pop-Tarts. And, you know, I could say all the time, Pop-Tarts probably aren't the best option. That could be a sometimes food. But when I got to the story behind it, she said, my parents did not have food, and I always wanted Pop-Tarts. My friends had Pop-Tarts, so I'm always going to make sure my daughter has Pop-Tarts. And so understanding that why just gave me better dialogue to have with her. Again, barriers could be knowledge, racism, transportation, technology challenges, time and work. So all of these things, if you could start really looking through, you're going to be an effective communicator. Consider new partnerships. So your local food bank RD, grocery store dietitians. You can read through all of this. One RD that is probably a really great resource for you is going to be your local WIC RD. And it's not because they just do nutrition education with young kids and caregivers, but what they also have is a robust referral system. So they're already going to have a list of local resources in your area. So you want to get your hands on that, and you want to refer to WIC, and you want to create that dialogue. But also another great, if you want to start really increasing your outreach from a diversity standpoint, that director of diversity at your local college would be a great resource because they are going to have a list of programs and resources that will help you make a better connection in the community. And certainly become a preceptor for dietitians. If anyone wants to do that or learn more about it, just send me an email. So the best thing that we can do is we want to follow up, document, and track. So we're definitely screening for food insecurity again and again, address concerns from the prior appointment. that are unique to that person, and did you make a difference? And make sure you document that with all that coding, right? Are they receiving food assistance yet? Are they taking their medication as directed and with the food needed? Are they following that medical meal plan, and how has their food access improved? So your next steps, if you choose to accept them, is survey your patients. Really get in and try to find out more information on what their barriers are from a collective, but also on an individual basis. And if you want to make a list of 3 or more local food relief organizations in your area, has a list, so reach out to them. And also your Feeding America dietitian who understands their member agencies. They know who to serve food to, those member agencies, so they will also have a great list for you. And then set up a meeting and consider for new partnership. And certainly we want to promote food and nutrition programs and encourage participation. So obviously you can use that list, right? So I would love for you to join me. If you want ongoing tools and resources, you can text Dignity to 44222, and certainly tune into the podcast. We just launched it for Hunger Action Month, and so we have some really great people. And with that, I'm going to pass it on over to Jean. Thank you, everyone. It was certainly an honor.
Wow, Clancy, that was great. I loved, just making us aware and sensitive to the reality of those clients that are visiting food banks, and with so many more people visiting. And it made me think about the saying that we all as dietitians certainly, or people working with the public, need to do, which is connect before we communicate. And I think that's really what I heard clearly from you. And I appreciate that insight. I love your stories. And then the point about, making sure that we recognize, educate, and collaborate. And I think what I wanted to say was that we are so proud as the dairy community and our partners that we are literally raising gallons in support of efforts to nourish communities. And so I want to show you this video that we did to encourage people to raise a gallon during Hunger Action Month, and it's back to school season. So just take a moment, let me roll them, and I'll be back with you.
The dairy community is working hard at getting gallons of milk to the people who need it. But we can always use more help. Why don't you join us?
Join in and show your support by raising gallons with us. Post your own video or photo raising a gallon of milk and use the hashtag #UndeniablyDairy to help us make a difference in your community.
Well, you might recognize some faces in that video. Our own Jerod Matthews is on the phone, and there were some dietitians, including Clancy. There were also all those NFL players and others, just to make it exciting, because milk is one of the most requested but least donated So please, you can join us in fighting hunger in your community by visiting milklife.com/give. While COVID, is an issue on everybody's mind today, I think we can all agree that this has really magnified some of the most pressing macro-level issues of our time. The need to feed and nourish a growing population, the challenges associated with food insecurity, and the pressing urgency to do more with less, while at the same time keeping sustainability at the forefront. First, the sudden closing of schools, as we've heard about throughout this call today, back in March, dramatically reduced the place that 30 million food insecure children rely on for nutritious meals every day. Then the restaurants were shut down, and with limited to drive-through and delivery, and Americans are doing a lot more eating at home. And third, as we've heard throughout this webinar, the loss of jobs has made millions of additional Americans challenged with food insecurity. And because of these challenges and disruptions with our normal food supply, access and distribution of nutritious foods has either faced shortages or no longer has a place to go. Our staff and others across and throughout the food supply chain have spent the last 6 months supporting initiatives that have focused on diverting and redistributing the milk supply to crucial areas like schools, food pantries, and grocery stores. So in the beginning, when things were shut down in March, you saw video footage of milk being dumped. But what we did was jump in there and re-divert that and get that to the places that it needed to go, like schools, food pantries, and grocery stores. And like we have discussed today, children have also been at a higher risk of food insecurity throughout this pandemic. During the school shutdown, the farmer-funded and our sister organizations, like Jerod was mentioning, the Gen Youth organization, created a For School's Sake, Help Us Feed Our Nation's Kids. It was a movement that helps to provide school districts with equipment and packaging and other supplies to help feed food service professionals, to help them feed our nation's children. The movement has generated close to $10 million since March for over 8,500 schools. In a recent Gen Youth survey of school nutrition professionals demonstrated that 100% of the respondents indicated that schools continue to operate school meal programs of those schools that received the grant. And this is a heat map that reflects the locations of grant applications from schools across the U.S., with more concentrated numbers in areas of denser populations mirroring the COVID-19 hotspots. You can see the pie chart that demonstrates what the grants are supporting at the various schools. And you can also visit Gen Youth's website to donate or apply for a grant for your school. Local efforts have also been taking place across the U.S. with the support for America's dairy farmers. Here's some great stories and examples of what has happened. For instance, in Wisconsin, over 12 million pounds of dairy products were donated to those in need. In Florida, we work with NFL teams, the Jacksonville Jaguars and the Miami Dolphins, to contribute over $10,800 to place cooler bags in schools. At Midwest Dairy, which covers over 10 states in the middle of the U.S., they donated over 1,500 soft-sided milk crate cooler bags and over 198 milk barrels to 100 school districts. And a number of local dairy councils have connected schools with processors to loan out refrigerated trucks to be on site on feeding days. And our very own staff have been at those sites helping to distribute and get that food to those families in need. We are so proud to have state and regional organizations across the U.S. working to provide solutions at the local level. So if you would like to find out more about that, you can contact your local dairy council or visit usdairy.com. And even with all the disruption over the last 6 months, people are still concerned about how their eating habits and healthy lifestyles impacts the environment, despite what's going on with COVID-19. Some surveys show that 58% of Americans believe that we should respond to climate change with the same urgency as we have responded to COVID-19. And as people were forced into quarantine, there was a dramatic decrease in carbon emissions seen around the world that no war, pandemic, or recession had caused before. I find that really shocking. The link between environmental health and personal health have underscored and realized by people that 50% saying the pandemic has made them more aware of the environment. And for youth, 82% agreed that sustainability was important to them before COVID, and 44% felt that is now even more important since post-COVID, showing that their passion and urgency around climate change is not going away. So pre-COVID, 88% of consumers wanted to see companies take the lead in developing more sustainable packaging standards. This is an interesting tension we're seeing rise during this time as safety has become a top priority for people, which is increasing the use of single-use plastics. We believe this shift is temporary and will swing back to the other way as companies are still focused on sustainability. We want to make sure that people know about dairy's story contributing to sustainable food systems. Nearly a decade ago, the Innovation Center for U.S. Dairy and expert dairy researchers conducted what's called a life cycle analysis for milk in the U.S. The results indicated that U.S. dairy accounts for just 2% of total U.S. greenhouse gas emissions. Relative to the nutritional contributions that dairy makes to the average U.S. diet, the footprint is small. It is because of efficiencies and best practices like precision breeding and nutrition, as well as water management and methane digesters. A recent study found that producing 1 gallon of milk can be produced today using 21% less land, 30% less water, generating 20% less manure, and 19% less greenhouse gas compared to 2007. The U.S. dairy community is committed to continuous improvement, and studies like this one show we're making progress, but this is not our end game. Now more than ever, our work on the environment is vital, and our commitment to it remains steadfast. I'm excited to share earlier this year the dairy community announced new aggressive sustainability targets for 2050, including ambitions to become carbon neutral, achieving net zero or better greenhouse gas emissions, to optimize water use while maximizing water recycling, and to improve water quality by 2050 with measurements every 5 years until then. We're very proud of these commitments. We're excited about the important role that dairy plays in a healthy and sustainable lifestyle. So in conclusions, what I'd say is COVID-19 has truly put a focus on hunger in America, as 1 in 4 children may experience some food insecurity in 2020. So I hope you will join us in raising a gallon during Hunger Action Month. And as health and wellness professionals, we all have a role to play, raising awareness on the impact of food insecurity on health, to screening for food insecurity again and again, and to connecting people at risk, some of whom may surprise you, and providing resources and support. We invite you to join us on our dairy journey as we become an environmental solution to the challenges of nourishing a growing population and protecting the Earth's natural resources. So now I'll just open it up to questions for Clancy, Jerod, or I.
Great. Thanks so much, Jean. And thanks for everyone for participating today. We have limited time, but I think one key question, Clancy, is if you can repeat where they can text for food dignity and resources.
Oh, sure. They can text dignity to 44222. Thank you.
Fantastic. And we'll include that.
Yeah.
our follow-up is awesome. Also, for Clancy, are pantries set up so people can choose their own food, like at a grocery store, rather than just being handed a bag of foods? Does it increase participation and increase dignity using a pantry?
Definitely. Thank you for asking that question. Obviously, because of COVID, we've had some challenges with that. But right before COVID in October, we did switch over to a choice. And we noticed a decreased food waste. We had a decreased volunteer time. It increased participation. And obviously, yes, that dignity. People could take what they wanted. And we were able to have better conversations because if maybe someone had disease management, and we were able to walk through people, look at labels with them. So it created more dialogue and communication as well, more of a community. But that is a big push for pantries across the United States. It's just unfortunate now with COVID, we're pivoting. We're constantly pivoting, right? But hopefully we'll get back to that.
Great, thank you. And this one perhaps for Jerod and or Clancy. There's questions about shelf-stable milk. Can it be distributed? Jerod?
Yes, I'll take a stab at it, Clancy, and you can, from your end, can add on. But yes, definitely it can be distributed. We are distributing in some places and agencies shelf-stable milk. Again, because of COVID, things have kind of shifted, but there are programs that our food banks have that require shelf stables, like backpack programs and things like that. So in order for those programs to be executed efficiently, yes, shelf stable milk is an option. And Clancy may be able to share a little bit from her end, from the agency end as well.
Oh, yep, we serve it. Definitely. We look for the refrigerated. We just served actually 600 gallons as we were talking today. But that was fresh milk, but we do the dry milk powder and we do the shelf stable as well.
Great. And then I think maybe one last question as we're over time, but Jean, there's a question of what's being done to improve distribution of food, especially given the amount of milk that was dumped during the pandemic?
Well, like I had mentioned before, we redirected the milk in order to go into food banks in the places that grocery stores, et cetera. And actually the whole industry did just what Clancy said. We made a major pivot to make sure that the milk was getting to the places that milk could be distributed. And so we partner with food banks to make sure those foods, whether it's milk or other foods, are, getting to those places.
Great. Thanks, Jean. I also wanted to thank everyone who participated and registered for the webinar today. We really had a strong interest in this webinar, and I think it speaks to what we are going through right now in America and the strong demand to help those and nourish our communities in need. So thank you for joining us today. As a reminder, you should have the slides, a handout to the slides and Clancy's resources and the reminder email that went out yesterday. But we will also be posting a recording of this webinar as well as a PDF of the slides to usdairy.com within the next week. So you'll be able to access them there as well. And the continuing education credits, including the ethics credit from the Commission on Dietetic Registration, will be ongoing, so you can listen to this at your leisure as well as share it with your colleagues. So once again, we so appreciate your participation today, and please look for future Dairy Nourishes Life webinars. Thanks so much.